I am beyond thrilled to announce that doors will soon be opening to the Wholesome Fertility Method online program. If you've been listening to this podcast, you know that I love to infuse meaning and spirituality into my practice, and I'm so excited to be sharing this program that I have put my heart and soul into. I have left no stone unturned with the creation of this program. This course includes everything that I provide for my patients, including how to understand your charts from a Chinese medicine perspective, detox recipes and protocols, simple and easy ways to go clean on products and cosmetics, research-backed nutrition that has been shown to improve fertility health, fertility-boosting supplements and herbs, breathing exercises, bonus fertility yoga videos, techniques to awaken your innate power to heal yourself, and what answering your sacred call really means. My deepest intention with this program is to empower and inspire you to align with your highest self. I will be offering both independent study as well as added coaching, which has limited spots available. If you're interested in getting on the waitlist, then don't wait. Visit www.thewholesomefertilitymethod.com now, as doors will only be open for a limited time. You will not want to miss it. Episode number 57 of the Wholesome Fertility Podcast. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist here to provide you with resources on how to create a wholesome approach to your fertility journey. My guest today is Dr. Denis Wilson. Dr. Wilson has a medical degree from the University of South Florida and is the co-founder of an herbal supplement company. Dr. Wilson developed the concept of Wilson's temperature syndrome in 1988 after observing people with symptoms of low thyroid and low body temperature, yet who had normal blood tests. He found that normalizing their temperatures with T3 and not T4, their symptoms remained improved even after the treatment was discontinued. As a result of his findings, Dr. Wilson developed the WT3 protocol for Wilson's temperature syndrome and originated sustained release T3. Dr. Wilson is the author of Wilson's Temperature Syndrome, a Reversible Low Temperature Problem, Doctor's Manual for Wilson's Temperature Syndrome, Evidence-Based Approach to Restoring Health, and the recently released The Power of Fastercise. He also speaks regularly at conferences throughout North America. So welcome to the podcast, Denis.
Hey, thank you so much, Michelle, for having me. It's an honor.
Yeah, it was great meeting you at the conference. A lot of what you were saying was extremely interesting, and this is why I decided to invite you on the podcast. And for the listeners, can you give an overview of how you began specializing in thyroid health and how you discovered the concept of Wilson's temperature syndrome?
Sure. I started in family practice, and I had a patient come in and ask me to read a book that she had, and the book was Dr. Barnes's book called Hypothyroidism, the Unsuspected Illness. And the main point of that book was that sometimes the blood tests can be normal and you can still respond well to thyroid medicine. And his recommendation was to give the person T4 containing medicine like desiccated thyroid and titrate the dose according to their temperature. And I did that in a few patients, and I was really surprised because not only did some of them get better, some of them got completely better. I mean, they're 100% better. I mean, they were completely normalized with that.
And it didn't show up on blood work.
Right.
Okay.
And their symptoms went away the way an itch goes away when you scratch it right where it needs itching, and
Wow.
right where it itches. And so I had a couple of patients, though. I had a number of patients who didn't respond very well to that. Their temperatures didn't really come up, and their symptoms didn't go away. And so I thought, okay, well, maybe this isn't thyroid. And then I also thought, or maybe it is maybe we just could need to try something else, some other thyroid hormone. And that's when I started looking at T3 because T4 is converted to T3. And so I decided to try that. And
Mm-hmm.
I found that a lot of my treatment failures, or the ones that failed on T4 containing medicine, were actually able to normalize their temperature on T3 alone, T3 only
Mm-hmm.
therapy.
Right.
And so that's how it started. And I guess more a little bit further down the road, I live in Florida, so some of my patients would go north for the winter, and when they did, a lot of times they would wean off the thyroid medicine, and then when they
Mm-hmm.
came back, I would start the treatment again, but this time they didn't need as much medicine, and which really surprised me. And then we started cycling on and off the treatment on purpose rather than on accident. And we found that a lot of times people were able to get on less and less medicine until they were able to wean off completely. So they were
Mm-hmm.
actually able to get reset.
That's awesome. And just for the listeners to know, like T3 is a more of
Well,
bioavailable.
yeah, so it's T4 is like a pro-hormone that the body converts into T3. So T4 is like the thyroid hormone supply, and that gets refined into T3, which is the
More
the
usable.
active form. Yeah,
So I guess some people, what I've heard in the past is that some people have a hard time or whatever it is in their body, the reason their thyroid isn't able to get the hormones is not from T4, it's the conversion of T4 into T3.
that's right.
So that's probably, it makes sense that T3 would be the better
Yes. Yeah.
hormone. Yeah.
Yeah. Exactly. And the more I look at this, the more I'm thinking that it may not actually be a. I mean, I've always had this. I've always had the sense that maybe this isn't really a disease, but more like um, more like an imbalance, and
Mm-hmm.
something that can be recalibrated and reset. And because that's the way it acts. Like the fastest I've ever seen this corrected, 100% corrected, was in a patient in about 6 or 7 days of treatment.
Wow. That's amazing. That's impressive.
Yeah. So we put her on the medicine. Her temperature went up, weaned her off the medicine, and you, with your pregnancy interest, you would appreciate that this was a woman with postpartum depression. It was actually my wife.
Oh, wow.
And so on her third baby, she didn't have postpartum depression on the first two babies,
Mm-hmm.
but on the third one, she got so depressed she couldn't really get out of bed and or off the couch. And this was just like 2 or 3 weeks postpartum. And so um, because was doing this day in and day out, I looked at her and I said, okay, she's just been through a major stress, which is typical of
Mm-hmm.
these people. So we checked her temperature, it was low. So I gave her some T3 and she started coming out of it within a matter of hours. And then by the next day or next 2 days, she was completely back to normal. And
That's
then
incredible.
we weaned her off the T3 and she stayed normal. So there's a lot of people, a lot of women out there, I'm sure, who
Mm-hmm.
have postpartum depression and low body temperatures that could be easily corrected with a little bit of T3 medicine.
That's amazing. So you're basically saying it's, well, we also see it that way as an imbalance between the yin and the yang.
Yeah,
And the yang is like the heat, and basically it's just a little bit of an imbalance that if you tweak it, everything kind of goes back to its normal harmonious way.
yeah,
But it's but when you do that, you said you put them on and then you kind of go back and forth and then you can stop and the body will start to recover and get back to its own balance.
that's right. I think of it kind of like rebooting the thyroid system. And
Mm-hmm.
because when you give somebody the T3, their own body makes less TSH and less T4 and less reverse T3. So it's kind of putting their own system turning down their own system and putting their own system at rest.
Mm-hmm.
And so then it gives a chance for a particular enzyme called deiodinase to increase or to upregulate and get back to normal. And then when you wean off the T3, then they have a chance at staying normal.
So what do you say to people that have gone to the doctor and they've been told that Synthroid will take care of it?
Um, what do I tell them when doctors have told them
Meaning,
that?
yeah, like if they don't know anything else and they think that what's the difference really?
Yeah. Well, I mean, if I was to, I don't normally like to try to talk people out of something that they believe in or they think might have a chance of working. But I might say something like, well, in my experience, um, the thing that matters is whether or not this thyroid medicine helps normalize your temperature. And there's a lot of
Mm-hmm.
people who take T4 that still have low temperatures. And so if you are going to try the T4, then you definitely want to watch your temperature. And if your temperature doesn't go up, then it may be that you have a conversion problem, and there's always the option of using T3 instead.
I see. So basically, try it out, and if it doesn't work, try something else.
Yeah, well, it depends. It depends how convinced they are. A lot of what I think it has to do with some of it is sociology and prejudice and things like that. And but
Mm-hmm.
if they I mean if they really want my opinion, and depending what their story is like, I might say, well, I really don't think that's probably going to be in your best interest, and probably what we should do is try resetting your system with T3. And if you do need T4, I mean, the first thing I look at when a person is comes into the office is, what is their thyroid hormone supply? And some doctors will tell patient, okay, well, you need T4. But then,
Mm-hmm.
but if you look at their TSH, their TSH doesn't really warrant T4. It doesn't really warrant any medicine. In fact, some people are better off with a therapeutic trial of herbs than they are T4 because
Right.
their TSH isn't really that high. They don't really have hypothyroidism, but some doctors have been taught and believe that, okay, there's people with TSH of 4 that still have symptoms, so I'm going to treat everybody that has that has a TSH above 3, I'm going to treat them. And then somebody will say, well, if they have a TSH above 2, I'll treat them. And
Mm-hmm.
that leaves out some people. So they say, well, I'll treat you if you have a TSH above 1. But I don't really think that's the solution. I think the thing, you know, the way I look at it is if your TSH is is um, is normal and your temperature's low, then I start thinking about a conversion problem, and that's when you can support
Right.
people with herbs or lifestyle.
Right. And so, as you know, it's a little the Wilson temperature syndrome is a little controversial,
Yes, definitely.
probably because they rely more on labs. What are your thoughts of why you think that there's such resistance to this theory?
Oh, that's a good question. I would say that there is, we've this theory has been out like 30 years now, and there's
Hmm.
been doctors that have been using it to treat their patients successfully for the last 30 years. I've had
Hmm.
um, I've had expert endocrinologists say to me that, it may be that we'll find out in the end that you guys have been right all along. But
Well, that's a lot of times how it happens. There's resistance, and then they kind of discover.
yeah, and so
Yeah.
even some of the experts, and when I say experts, I mean the ones that even write the guidelines for the national mainstream medical doctors to follow in thyroid treatment. So I mean, there's some open mindedness to it, but
Yeah.
basically there's a big you have what there's a big tradition or machine. I don't know what you call it, but there's a big system in place, a big tradition in place that involves, it involves medical school, it involves training, it involves the insurance industry, it involves licensure boards, and it's just a lot of inertia, I guess. And
Hmm.
to do things differently is, it's not the most nimble system in the world. I one time, after 10 years of talking to people about this, and some of the doctors I was talking to at a conference, they were like, well, this works so well, and I asked them, I said, yeah, we've been talking about it 10 years. I said, what do you think it will take? And somebody said 20 years.
Hmm.
And but I recently heard another theory. They said that new ideas don't. The only time new ideas really get accepted is after everybody that was opposed to them passes away.
Yeah, that makes
So,
sense.
so I don't know.
People end up fighting to the death to be right. And
Yeah.
so any change sometimes can seem very threatening to a system that's very set in its ways.
Yes.
Which I think a lot of systems in the world are.
Yes.
But I appreciate the fact that you're going past that and really are very open to doing so, because that's what it takes really for growth to happen and
Yeah.
discovery. Nobody's saying everybody's 100% right, but you discover, you have to try and
Yeah.
figure it out. But if you're seeing such success over 30 years, there's obviously got to be something
Oh,
to it.
yes.
I mean, it's the proof is in the pudding.
It really is funny that you get on TV and you watch a movie that's only 10 years old or 15 years old, and you see the phones they were using then and the computers they were using then, and you think,
Mhm.
wow, how much different are things now than they were then? So, in every other industry, change is
Right, that's
completely
a good
normal,
point.
and
Mhm.
accelerating change is completely normal as well. And, you can't do anything better unless you do it differently.
True.
Uh, so I do believe in, doing things as well as we can.
Yeah, absolutely. And so just for the listeners to hear, what are the symptoms of hypothyroid? If they're feeling certain symptoms, at what point should they go and seek either natural help or some kind of treatment? At
Yeah.
what kind of symptoms should they look for?
Well, the classic type of symptoms are fatigue. When people have low temperatures, they can be tired. They can have depression. They can have irritability, anxiety, panic attacks, fluid retention, headaches, itchiness, even asthma, PMS. Uh, did I say itchiness? They could have
Mhm.
hives. They could have difficulty sleeping. Um, um, there's there's just so many things. Just a rundown feeling, and it's kind of it's a little bit like the feeling a person, like you can imagine a person who gets run down from being under a lot of stress and
Mhm.
not exercising well, not sleeping well, maybe being very lethargic, just and that sort of thing, and they just don't feel well. But that it's kind of like that feeling. Another sensation is the emotional part, where people describe it as feeling like they're at the end of their ropes, and
Mhm.
they just can't cope with anything. Like they don't feel like taking out the trash or cleaning a dirty diaper, or just the smallest things seem like the biggest things. And so, but anyway, anybody who's suffering from anything like that, I would totally recommend them checking their temperatures to see if they're low.
Meaning basal body temperature?
I recommend people, yes, take their temperatures by mouth.
Mhm.
And there's a description on wilsonsyndrome.com. There's a description for how to do that. But basically, you measure your temperatures by mouth with a thermometer, a liquid metal thermometer I prefer. And you do that every 3 hours, 3 times a day, starting 3 hours after you wake up.
Mm-hmm.
And then you get the average. And the reason is that the significant shift in temperature typically happens during the day, not so much first thing in the morning when they wake up.
Mm-hmm.
So I usually don't recommend people take their temperature when they first wake up. I mean, you could do that, but I don't instruct people to do that.
And for thyroid health and fertility, how can regulating the thyroid improve fertility in those who have some kind of subclinical hypothyroid condition?
Well, I know that in my experience, the doctors that have been least resistant to using thyroid are obstetricians
Mhm.
and psychiatrists, because in both of those fields there's a lot of research that shows how helpful they can be, both in fertility and in mental health. And I think it's one of the first things that obstetricians check for in an infertile patient. The only problem is they check the TSH, but body temperature has everything to do with fertility. And
It
yeah,
does.
it's the ovulation and the spike of the ovulation. I mean, the spike in temperature indicates ovulation, but it's more than just that. I mean, if your baseline temperature is a degree below normal, I mean, the chances of maintaining, of conceiving and maintaining a pregnancy are far less.
Mhm.
Basically, the way I would explain it is that, you know, there is quite an interplay between T4 and epinephrine and mitochondria and everything that generates energy in the body.
Mhm.
Incidentally, incidentally, I was noticing today the similarity between, if you look at the molecular structure of epinephrine and compare it to thyroid hormone, it's remarkably similar. And
Really?
yeah,
That's
and
interesting.
and what's interesting is thyroid hormone increases many of the key intermediates in the cascade that epinephrine stimulates. And so what I'm saying is epinephrine and thyroid kind of stimulate the same kind of energy pathways, and
Hmm.
those have a lot to do with the mitochondria. And that has to do with energy, and energy has to do with everything that happens in your body, including how well you sleep, how well you detoxify, how well you conceive, how well you maintain a
Hmm.
pregnancy,
Right.
how well you do
Egg
everything.
quality.
Yeah, yeah, totally.
It's really interesting. So speaking of energy, uh, what is faster size?
Fastercise is a um, method of lifestyle that I developed based on some research that I've seen. And I studied, remember I said that there are some people that still had they still had symptoms even though they were on the thyroid
The
hormone,
Synthroid?
the Synthroid.
Uh-huh.
So then I started using T3. Well, one thing that happened is I noticed that even though I got some people with T3, I got their temperature up and they
Hmm.
were feeling a lot better. Some of those people still had a lot of trouble with their weight.
Got it.
And some people lost 100 pounds. Some people lost 34 pounds in a month. I mean, some people lost weight without doing anything different. But
Just from adding T3.
yeah, yes. But there were some people who still, weren't able to lose their weight. And I wondered, I puzzled about that for years, more than a decade. And so I decided to look into it a little bit more. And so I studied it for a year or so and looked at all the research I could. And then, there's a lot more research now than there was 30 years ago. And I kind of went through that and looked at what it was saying and saw if there was a different way to connect the dots. And that's how I came up with Fastercise. But it's the first program to use instinctive exercise. It's what I call instinctive exercise, and
Mm-hmm.
you use it to push off your hunger and direct the body to burn stored fat, and at the same time build muscle and increase the size and number of the mitochondria.
Amazing. And how does one do that?
Well, there's our website is fastercise.com,
Mm-hmm.
and there's some videos on there. There's like an introduction video that explains it, and there's also some example videos, and just available today and or just recently anyway. There's an app, Fastercise app, that people can download for free off Google Play or off Amazon, store, not Apple Store, sorry.
Mm-hmm.
And but anyway, how you do that? There's two kind. What I call them instinctive exercise, because there's two kinds of exercise we do naturally
Mm-hmm.
or instinctively, and that is we stretch really, or we tighten our muscles really hard when we first wake up,
Mm-hmm.
and the other one that we do is we shiver when we get really cold.
Mm-hmm.
But the reason I believe that the reason we do the tightening of our muscles when we wake up in the morning is that we've been fasting all night,
Mm-hmm.
and our blood sugar is low, our energy levels are low, and we've been fasting. And so when you tighten your muscles like that, there's four hormones that go up, including epinephrine, growth hormone, cortisol, and glucagon, and those cause an instant release of glycogen from our muscles that provide glucose, and also it breaks down fat in our fat stores to provide fatty acids, and that gives us the energy to get up and walk around and hunt down breakfast.
Right. Interesting.
And so one thing that I thought about that is like, well, if that's true, if you can release energy that way from tightening your muscles, then if we get hungry during the day, we ought to be able to tighten our muscles really hard for like 6 or 8 seconds.
Mm-hmm.
And then our appetite ought to go away. So I tried that, and sure enough, it does. Like if there's any
Interesting.
Yeah, so if there's any listeners right now on your podcast who are feeling hungry right now, they could just tighten, their biceps and their triceps and their chest muscles and their lats and their abdomen and their back and their thighs and their quads and hamstrings, and tighten everything is super 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 hard for like 10 seconds. And by the time they relax their muscles, they'll find that their appetite is much less, if not completely gone.
That's fascinating.
Yeah,
Really interesting. So you're saying this also increases the size of the mitochondria, which, by the way, if people don't know what that is, it's the powerhouse in the cells that holds ATP. And actually, as women age and ATP lowers, that's what causes lower egg quality. So this is actually it sounds like a great exercise for women who want to increase their egg quality.
absolutely. Yeah, it's amazing how many, there is research on high intensity exercise and epinephrine and things like that. But what they haven't really shown is there's a couple things they haven't mentioned is how little exercise, how what's the smallest amount of exercise you can do and still get these benefits. And also they haven't really talked about the high intensity exercise that I find the most effective and the easiest, and that is shivering. And
Right.
the shivering, the reason why the, the reason why I'm convinced that that's the most effective form for building the mitochondria is that the thing that builds the mitochondria is when you use ATP faster than your mitochondria can make it.
Right.
Uh, and when you overwhelm your mitochondria like that, you start building up acid in your muscles, and then you start breathing faster because your body breathes faster to get rid of acid. That helps the body get rid of acid to breathe faster.
Mm-hmm.
And then if you keep the intensity up and you shiver fast enough, long enough, then you'll get so winded that you'll actually catch a deep breath, or maybe kind of like gasp for
Mm-hmm.
a deep breath. And that's your sign that you have overwhelmed your mitochondria enough that you basically your mitochondria say, "Oh wow, Michelle, you just overwhelmed you just overwhelmed your mitochondria, so you're going to have to make more for tomorrow."
Mm-hmm.
And so,
So then it makes more to keep up and keep at a
yes,
balanced rate.
yes, and so it basically upregulates just like everything in your body. So like, I mean, you exercise a muscle and a muscle gets bigger to cope with it, but when you exercise your mitochondria, you get more of them, and then they get bigger. So it's the same concept. And so when you do that, just do that enough to get winded every day. Then every day that passes, you're getting stronger and stronger, and your mitochondria are getting more and more. And you'll find that over time, it'll actually you'll actually gradually it'll become a little bit harder and harder for you to get winded. So whereas before you might have gotten winded in a deep breath in 20 seconds,
Mm-hmm.
later on it'll be 30, and after that it'll be 40, and after that it'll be 60, and after that it'll be a minute and 20 seconds, and so on. But when you're getting like that, you're getting really, really strong. And so I just want to touch on this. What is it about shiver size? Well, that's what I call it, is shiver size.
Mm-hmm.
But what is it about that? Well, if you think about it, when you get cold, that's an emergency. Your body is losing temperature,
Mm-hmm.
and that your body is recognizing that this is a real problem and it has to stop, and we have to turn that around right away. And so the thing it does to increase its temperature is it shivers. And
Mm-hmm.
and we shiver because that's the form of exercise that releases that goes through or utilize or uses up the most ATP and releases the most heat of any other exercise we could do.
Mm-hmm.
And so, um, and that's why we do it. It turns out that a shivering muscle releases 3 times more ATP than a statically contracted muscle.
Wow. That's
Yeah.
really, really fascinating.
Yeah. So like a moving muscle, see, you have to, when you move a muscle or you're shortening the muscle, you have to break, you have to break and rebuild, break and rebuild. You have to break and rebuild more actin and myosin cross bridges.
Mm-hmm.
And so that's when you're moving it. But when you're moving it quickly, you have to build that many more cross bridges, and cross bridges take ATP.
Interesting. Wow, this is really interesting. And also, I mean, you're saying that that's what the body does to increase its temperature.
Right,
And it kind of goes back full circle
right.
that this is a great exercise to do if you are hypothyroid, because
Oh yeah, totally.
not only is it going to help with the mitochondria, but it's also going to help to increase your body temperature. It's basically utilizing what the body does naturally and just and almost exaggerating it to trick the body into doing what it needs to.
Yeah, and exactly right. The more I see the benefits of this in myself and other people. I mean, I know people that have lost, like this one girl with polycystic ovarian syndrome. She's lost 55 pounds in about 6 months when she's tried everything else and she could never lose weight.
Hmm.
And but anyway, the more I look at this, the more I begin to think that Wilson syndrome and this low temperature and hypometabolism that's so rampant. I mean, it's epidemic in our society. All these people are having these symptoms. But the
Yeah.
other the other thing that is rampant in our society is the the advance of modern technology, and
Hmm.
in that advance of modern technology, we can get more and more done with less and less effort. So
Right.
you just press a button and you get a pizza or something
Use
like
your
that.
thumb.
Yeah,
Yeah.
yeah. And so with that, we have modern appliances, and so you could ask somebody. you could ask one of your patients, ask any of and the people could ask themselves, your listeners could ask themselves, if they are having trouble with fertility or any of these symptoms, they could ask themselves, when's the last time I got so winded I had to catch a deep breath?
Right.
You
That's a
know,
that's a good question. Yeah.
was it a week? Has it been a month? Has it been a year? Has it been 5 years? Has it been 10 years? Because there's some people, that, we just don't get winded anymore. But, if you shivered, see, when you shiver like this, when you're hungry,
Hmm.
let's say you wake up and you get hungry. Well, you shiver and you might shiver for 20 seconds and you might get
Hmm.
pretty winded, or you might
Hmm.
shiver for 30 seconds and get pretty winded. And then an hour later, if you start getting hungry again, you could shiver again. Well, you just got winded twice in one morning when you might not have gotten winded twice in the last month.
Right. And it seems like doing it is not going to take that much out of your time or day, to get those benefits.
No.
What I was going to ask is, so is this only when you're fasting, like in the morning or when you're on an empty stomach?
Um, no, it's not only when you're fasting. It's particularly helpful when you're fasting. It sort of depends what you're trying to accomplish. Like,
Like if you want to increase mitochondria.
okay, if you want to increase mitochondria, you can do it anytime you want.
Hmm.
But any time of the day you want to get winded, you can do that, and that'll increase your mitochondria. But if you're also interested in losing uh, burning stored body fat without getting hungry,
Hmm.
then you would want to do that when you get hungry. When you get hungry, then you shiver. You can, and the reason when you do that is, like, when you get hungry, those four hormones I mentioned tend to go up because they're mobilizing your glycogen and your stored fat. And it's interesting that fasting increases, those are called counter-regulatory hormones. They're counter-regulatory to insulin. And
Hmm.
so it causes your body to burn its energy stores, just kind of like when your phone discharges its battery, you're discharging your energy stores. But
Hmm.
those that happens when you get hungry. And the curious thing is that also happens when you shiver. Because when you shiver and you start demanding more energy, your body says, oh, gee, she's demanding more energy and we need to provide it right now. And it does it by mobilizing your energy stores. So
Right.
when
Because
you
you're
add
fat.
those, yeah. And so when you add those two effects together at the same time, it's just compound. Like, you're not sending mixed messages. You're sending, yeah, we want to burn this stored fat and we want to burn it now.
Right.
So
And that's typically when you're fasting so that it can use the stores rather than what maybe some carbs you just ate.
that's right. That's right. Totally. And
Because
and
it's
the
always going to go for the carbs first.
Yeah, that's right. And so that's the normal tendency, is like, oh, I'm feeling hungry, and so I better get something to eat. And maybe it's even a carrot, or maybe even it's a piece of potato, and that's fine. But that's healthy. But it's better than a donut. But your insulin is going to
True.
go up.
Right, right.
Your insulin is going to go up, and when your insulin goes up, you're not going to be burning stored fat. So
Yeah,
you can go get a piece of potato and stop burning stored fat, or you can do some shivering and keep burning stored fat,
right,
and your appetite goes away either way.
right.
So
Interesting.
so there is one other couple of things I want to mention about that, and that is that, I mean, a person could shiver, or just doing this tighter size is what I call just the static contraction. You can
Hmm.
do that. There's a lot of people who have to wear a sweater when other people don't. Like,
Hmm.
they're in a room and they're freezing to death.
Yes.
So yeah, you don't have to wait to do it involuntarily. I mean, you don't have to wait till you do it, like, yeah, involuntarily. You can do it voluntarily. So you can. I swallowed a temperature probe, and tracked my temperatures over a couple weeks period of time, and
Oh, wow. That's interesting. What is that?
it's
The
called I think it's called an ECAP, but
mhm,
it's a temperature probe that comes in a pill and you can swallow it. And
mhm.
it's a wireless transmitter and it transmits the data to a module on your it records the data on the pill and then it transmits it to a module like a phone looking thing.
Mhm.
And then but when I did that, I found that when I would when I would shiver like that, my temperature would go up more doing that than like or as much doing that as a half-hour bike ride.
Interesting.
But the difference is when I stopped my bike ride, my temperature would come right back down. But when I stopped the shiver size, my temperature would stay
Would
up.
stay up. I wonder if I mean, and you definitely kind of think outside the box, which is great. I wonder if women should do that during ovulation and during their luteal phase.
I think so. I think so. Um, I think it couldn't hurt. And the reason why I say that is because it's not just, I mean, your listeners can try it for themselves. And the point is that like, if you shiver like that, like that's what I did on my own. It went up and then like an hour later, I did it again and the temperature went up some more. And an hour again
Mm,
later, temperature went up some more. And so I was able to build my temperature up by over a degree just by doing that like every 30 minutes to an hour. And
mm.
so and my point is that it didn't plummet right back down. I mean, eating
Right,
lunch,
it's sustained.
yeah, eating lunch will drop your, I mean, will increase your temperature as well. But no, I could see some, but it's not only that. I mean, not only does it's not only what it does in the moment, and it's not just what it does over the hour, but I think it's also what it does from day to day. Because
Mhm,
I think when you're doing that, you're kind of telling your body, see, I have this thing, I call it storage mode or forage mode.
mhm,
And there's two different survival strategies that our bodies have. One is storage mode, where you store as much energy as you can to survive famine. And that's
mhm.
one way of going. And if you choose that route, you don't want to have a lot of muscle because that burns energy, and you just want to have a lot of fat. But the other is a different strategy, and I call it forage mode, and that's where you don't rely on um, you don't rely on what you have stored in your body. You rely on what you can gather around you, like a hunter gatherer.
Mhm.
You rely on being able to climb a coconut tree and grab a coconut and crack it open and eat it, and
Right.
hunt an animal and different things like that. And for that, you need muscle, and you don't want a lot of fat, because if you have a lot of fat, it's hard to be fast.
Right.
And so when you do this kind of faster size, and you're training your body to get out of storage mode. I think a lot of us in our modern technology, our modern society, we are in storage mode
Mhm.
because we're just eat. The pattern for storage mode is get
Eat,
hungry,
eat and
eat.
watch TV.
Yeah, yeah,
Yeah.
exactly. And then, but with the forage thing, it's different because it's you get hungry, then you forage, and then you
Right.
eat. You
Right.
forage
It's like
before you eat.
you eat to survive. It's a different mentality. It's like you don't live to eat, you eat to live.
Right,
And
right,
you eat just when you need to eat and then you keep going back out and being active.
right. So when you get hungry, um, I mean, like in modern times, when you get hungry, you're right. We eat instantly because it's readily available. But
Mhm.
I think anciently people would get hungry and then they're like, okay, I'm hungry. I need to go get something. And they didn't have
Yeah.
refrigerators, so they'd have to go get it. And they'd
Right.
have to go. And then, so there's always some kind of exercise before they ate. There was a time between the
That's a good
time they,
point. Yeah.
so they would get hungry, they would exercise and then eat. Get hungry, exercise, then eat. Get hungry, shiver, and then eat. Get hungry,
Right.
shiver, then eat.
Yeah. That's a really good point. It's And what do you think of intermittent fasting?
Well, I believe in it, especially. I mean, I think it's great idea. I guess different people mean different things by that term, but what I mean by that term is spending less time in the fed state and spending more time in the non-fed state.
Hmm.
I think it's terrific because I think definitely I think a lot of us, I mean, a lot of people with metabolic problems, especially,
Hmm.
um, especially people that have a tendency towards being overweight or that are obese or have some, when I think a lot of us are struggling with that because we do spend too much time with our insulin levels high, or we eat too frequently, and and we don't spend enough time with. Basically, we spend too much time building up our storage and not enough time uh, using up our storage.
Right. Yeah. And it goes back to the whole balance thing. Just
Exactly.
really living in balance. I think it's good to reset. It's almost like what you said about giving your thyroid a break and
Yes.
having it reset itself. The same thing with digestion. Every once in a while, fasting's been used for throughout history,
Yes.
just in general. I'm not to overdo it, of course. Some people overdo it. It's too much, but you got to have it in balance, definitely, to reset the system
Yes.
and allow. Yeah.
Yeah, that's been part of what I was part of the what I've seen in the literature lately. I've seen a lot of good things about that. Some amazing things. And so, for example, um, they did this one study where they had people with high blood pressure, and I think it's like a 7 to 10 day fast in these
Hmm.
people with high blood pressure, and every single one of those people was able to get off their pharmaceutical drugs for blood pressure.
Wow, that's
And so,
incredible. So 7 to 10 days of just water.
um, I don't know if it was a complete water fast, but I'm not sure about that, but yeah, I think it was just water.
Wow, that's incredible. It is amazing. Fasting's there's definitely something to fasting that really helps the body heal.
I totally agree, and I think it really helps, heal the gut. And of course, the gut is a major source of problems in health. I mean, the
Yeah.
naturopathic concept of heal the gut, like all disease begins in the gut. I don't
Hmm.
think it's that far fetched.
No, it's not. It's not at all. It was interesting. It was during the conference that we went to when they were talking about how some of the microbiome actually need to be in a state. They actually thrive in a state where there's no food.
Yeah,
So that's part of keeping things balanced is having a break and having those states come up
yeah,
sometimes and not always just being full or always being satiated. Like you gotta have a little hunger.
yeah,
It's okay.
yeah. Michelle, one thing I like to do is I like to deplete my glycogen stores, pretty regularly, essentially every day. So, and the nice thing about getting rid of your glycogen stores, and for listeners that may not know, glycogen is a storage form for carbohydrates that's in your muscles and in your liver. And on on any given day, you might have enough glycogen in your system to power your body for a day or 24 hours. It typically has about 1,800 kilocalories in it, and on average, depending on the size of the person. But that's an easily mobilized source of energy for us to live on. And but the nice thing about depleting it is, you know, if you if you get rid of your glycogen, basically spend some time hungry or getting hungry and shivering instead of eating and pushing off your hunger with shivering, you're using up your glycogen and you're depleting it. And
Right.
what's nice about that is if you have, if your glycogen's empty and then you eat a big meal and maybe even do have um, some mashed potatoes or something that has carbohydrates in it, you'll have a place to store them because those carbohydrates will get stored as glycogen. But if your glycogen's already full and you eat a bunch of carbohydrates, then they'll have nowhere to go except to be stored as fat.
Good point. Yeah. So your muscles will eat them
Yeah,
basically if they're empty there.
yeah,
So basically people could do this if they don't do intermittent fasting, or they could do this every morning before
yeah,
they eat.
yeah.
That's the best time.
Yeah, definitely. And the other way of doing it is, let's say they don't want to do intermittent fasting. Well, you can do this even if you want to eat 4 times a day. If you want to
Hmm.
eat 4 times a day, that's not what I do. I eat only twice a day. But if somebody wanted to do 4 times a day, that's fine. And this is the way you would do it. You could wake up in the morning, you could shiver some, and then you could get a little something to eat. And the emphasis there is on little, because
Hmm.
the less you eat, the sooner you'll get hungry again. The less time you'll spend in the fed state, and the sooner you'll get back into the non-fed state. And when you get hungry again, then you could shiver again. And then
Right.
after you shivered, like, you could go ahead and eat a little something for lunch. So, and when I say a little something, I mean, as soon as your appetite gets satisfied, you stop eating. You don't eat past satisfied, you just eat enough
Right.
to be satisfied. So,
Exactly.
so you're just pushing off your hunger, and your hunger will come back again before dinner, and then you could shiver again. So you're shivering. You're following that pattern where you get hungry, shiver, eat, get hungry, shiver, eat, get hungry, shiver, eat, and you could do
Right.
that 3 times. It just depends. It's just a matter of balancing how much you eat and how often you eat.
So do you want to share your information about your book for people who are more interested in learning about Fastercise?
Yeah, that'd be great. We're pretty excited. The book just came out. The book is called The Power of Fastercise, and it's available on Amazon and Barnes and Noble and everywhere. And and even though it was released just a few days ago, it's already the #1 new release in endocrinology and metabolism on Amazon. And
That's
it's well,
awesome. Congratulations.
thanks. And we've been watching the ranks go up this just hour by hour, but currently it's #7 and it's the #7 top seller in endocrinology on Amazon
Nice.
right now.
And I'm gonna go ahead and link to that book
Okay.
on the episode notes. So if anybody is curious and wants to find it, it's going to be right there. And where can people find you or more about you?
They can go to wilsonsyndrome.com and or fastercise.com and or
And
restorative-formulations.com.
right, which is where they can get the supplement that you were talking about earlier.
Yeah, their doctors can get the supplements there.
Right, because it's medical grade.
Yeah, and the other thing to mention is on fastercise.com, or you can just go to the Google Play Store or the Apple Store to download the Fastercise app, and that will guide you through it too.
Awesome.
And that I mentioned this before, but that app is free.
That's even better.
Yeah,
We love free. Everybody loves free.
yeah,
But this is great conversation, fascinating information, and I really enjoyed speaking with you, Dennis. This has been wonderful. I'm really glad you were able to come on to the podcast. Thank you so much.
yeah. Thanks so much for having me. One thing I don't think I mentioned is that there's also coaching for some people. They want somebody to coach them through this, and we have that available too.
Okay, fantastic. Awesome.
All
And they can
right.
find that on your website,
Yes,
correct?
on fastercise.com. Right.
Okay, great. Well, thank you so much for coming on.
Thanks, Michelle. Appreciate it.
So that concludes today's episode. You can find all the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to leave a review. Reviews are everything to podcasters. You can find me on my website at www.thewholesomelotus.com. And please be on the lookout for my online course and program. This course has emerged from everything that I've been using for the fertility program I now offer at my office. I wanted to consolidate all of my suggestions and coaching and put it into a form that anyone can purchase and use. It was important for me to encompass key fertility health factors as well as guide you in implementing changes in your routine that are shown to boost fertility while being realistic and user-friendly. I will be offering this course with and without coaching. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com, where you can find the subscription form. I thank you so much for listening in and hope you have a beautiful day.